There are several important properties of an emulsion, okay, that we have to remember to be able to ensure that the emulsion that we prepare are stable. So the important characteristics of an emulsion are it consists of two immiscible phases, which are oil and water. The appearance are usually cloudy, whitish solution, but for nano emulsion that I mentioned earlier on, it may be less cloudy, okay? But it's not a clear solution. But for the normal emulsion that we prepare in the lab, the appearance would be a cloudy and whitish solution. The droplet size commonly ranges between 0.1 to 100 micrometer. And the particles or the droplets, okay, the internal phase droplets cannot pass through filter papers. Emulsion may have different viscosities depending on the type of dosage forms. So lotions for external use will have a low viscosity as compared to creams, which has a higher viscosity. So for oral use, usually we will prepare oil and water emulsion due to the taste, okay. But for external use, we can prepare both, either oil in water or water in oil. But there are differences in terms of the properties, which, as an example, for oil in water external emulsion, it will be easier to clean, while for water in oil will produce an occlusive effect. Occlusive effect means that it will protect the skin from losing moisture, so it will be much useful for dry skin. Advantages of emulsion can be described as follows. By formulating an oil into an emulsion, we would be able to disguise the taste or oiliness of medicinal oil. As an example, if you want to take fish oil as it is, the taste is not acceptable by many patients, especially children. So formulating the fish oil into an emulsion with added flavoring and coloring will increase the acceptance of patients, especially the pediatric patients. The unpleasantly taste oil can be washed off from the tongue or the mouth with a drink of water. So if the taste of the oils are still present, this can be easily washed off by drinking a glass of water. Emulsion will also help to improve the absorption of oil, as the oil droplets are now finely divided, okay, into small droplets. This will increase the surface area and subsequently will increase the rate and amount of oil absorbed in the intestine. The intramuscular injection of some vaccines in the form of water in oil emulsion will provide slow release or depot for the vaccine or for the formulation, and hence there would be a greater antibody response for the vaccine given. Total parenteral nutrition, as an example, is a product that is formulated in the form of emulsion. So this total parenteral nutrition, or TPN, is a sterile oil in water emulsion used to deliver oily nutrients such as vitamins by using non-toxic emulsifying agents such as lecithin. TPN is a product that is given in the hospital for patients who can't tolerate food by mouth. So as an example, patients who has a major surgery involving their gastrointestinal tract, in this group of patients, the doctors wouldn't give anything through the mouth to help or to improve the rate of recovery following the operation. So this kind of patients will receive the nutrition through intravenous route. This is what we call as total parenteral nutrition, when the patient eat nothing by mouth and the nutrition are given by intravena. But there are also some patients who receive TPN and also receive food by mouth. So the calculation has to be adjusted, and this you will learn later on in your third year or final year.